Is your back pain or neck pain being caused by arthritis? And if it is there anything else that you can do other than taking painkillers or anti-inflammatory medication? If you're like a lot of the patients that I see in my office that are struggling with back pain and neck pain, maybe you've been told that you have arthritis, you might be medicating. You might be taking things like Advil or Aleve, maybe even something prescription like Voltaren or Celebrex. And while these medications can give you relief in the moment, they're not actually addressing what's causing the problem, and they come with side effects, gastrointestinal problems and other side effects which can get worse over time. And what I want to do in this video is I want to demonstrate to you what it visibly means. If you've been told that you have arthritis, I want to give you a visual picture of that, what it means. I want to explain to you what's causing it. And most importantly, I want to point you in the right direction. If you're looking for a natural solution to spinal degeneration and arthritis pain that will actually help you reduce the amount of medication that you're taking and possibly even eliminate it altogether. My name is Dr. Tim Silvester. I've been a chiropractor in Orillia for 22 years at Grace Family Chiropractic, and we have helped thousands of patients with spinal arthritis, with sciatica, with neck and lower back pain, symptoms in the arms and the legs over the last 22 years. And we've helped them find a natural solution in doing that. And the way that we do that is we offer a hands-on approach to restoring optimal spinal movement and alignment so that we can reduce and relieve arthritis pain over time. So what does it actually look like if you've been told that you have arthritis in your spine? To help demonstrate that, I have two models in my hands here. In my left hand, I have a normal, healthy spine. There's two bones or two vertebrae on the left hand and two on the right. And what you'll notice is the main difference is on the left hand here, the spaces between the bones, which are occupied by what are called discs. These discs are nice and thick and full. There's no thinning or degeneration. By contrast, when you look at these two vertebrae in my right hand, you'll notice that the discs are thinner. They're flattening, they're degenerated. The other thing that you'll notice is that in a healthy spine, the edges of the bone are smooth. In a spine with arthritis, you'll notice that there are actually bone spurs that are sticking off the edge here. And those are the two most common findings that we see in patients who have arthritis, that the spaces between the bones are getting thinner, as well as the formation of new bone spurs on the edges of the bone. And just to give you another visualization of what that looks like, because the way that we diagnose that is by looking at your x-ray. And we have two x-rays here. On my left side here, on my left hand, we have a normal, healthy spine. This is actually a neck x-ray from the side. When you look at the neck from the left side, there should be a nice, smooth, C-shaped curve. And when you have that curve, what they found is that the discs in the front of the spine only take about 30% of the stress. Most of the stress is supposed to go through the joints that are in the back of the spine. And when you have that balance of 30% of the stress in the front and 70% of the stress in the back, it balances the load and it prevents the spine from breaking down prematurely. By contrast, if you look at this image to my right here, you'll notice that the posture is different. Here the neck is straight and forward. Many of the patients that I see nowadays have what is called forward head posture or anterior head carriage. And what you'll notice is that the spaces between the bones, again, you'll notice that the discs between the bones look much thinner on this image on my right here. The other thing that you'll notice again is that you'll see the bone spurs that are actually showing up on the front of the spine here. So those are the two findings that you see in patients who have arthritis in their spine, thinning discs and bone spur formation. Now the question is, what actually causes that? Because I could take two patients that are the same age, that are 50 years old, and one of them has signs of arthritis and the other doesn't. So the first thing I want you to understand is that if you have arthritis in your spine, the first thing that can cause it is immobility. If you have a spine that doesn't move properly, they've shown that your spine will break down faster. Maybe you're somebody who has a hard time turning your head to check your blind spot. Maybe you're somebody who has a hard time bending over to touch your toes to tie up your shoes. If your spine is not moving properly, it's going to put stress in parts of your spine where it doesn't belong, and that area is going to degenerate faster. The second thing that can cause it is the alignment of your spine. If you're somebody who has terrible posture, if you have forward head posture, if you're slouching, again, that alignment is going to put undue stress in different parts of your spine, and the areas where that stress is concentrated are going to break down faster. So if you have degeneration and arthritis in your spine, we need to address those two things. We need to make sure that we restore the proper movement to your spine to get your spine moving fluidly, and we also need to get your posture and your alignment optimized or corrected. So the question is, how do you do that? If you have arthritis that's related to these things, you need to restore the alignment, restore the movement. And we do that through chiropractic adjustments. We also do that through very specific movement and exercises that complement your adjustments. And I realize that many of you watching this video, perhaps you've never been to a chiropractor, you've never seen what a chiropractic adjustment looks like. So what I'd like to do is in the comment section below, I'm going to include a link to a video that will actually demonstrate me adjusting a patient in our office so that you can get a good picture of what that actually looks like. If you are somebody who is suffering with spinal arthritis, I want to make sure that you ask the questions that you need to ask to get the help that you need. If you have any questions, please post them in the comment section below so that we can have a dialogue about that. And we can point you in the right direction so that you can get the help that you need. And again, if you have any other concerns or comments, please don't hesitate to reach out to me. You can subscribe to this channel. There'll be other content that you can see that's going to help you with arthritis pain as well. Again, I'm Dr. Tim Silvester. Hope you found this video helpful and informative. If there's any questions that you have, please let us know. Take care and bye for now.